Hello, I'm Mrs. Sakura, and today I'm going to be sharing Trache Care and cleaning with you. Before we get started on this skill, I want to show you a few important things about the trach and some of our different supplies that we have here that you might see in the clinical setting. Here's a trach collar. Not all clients will have these. This is very similar to a face mask. So it's hooked up to wall oxygen. You also can have a humidified water bottle there. And so if you do have a patient that has one of these, during cleaning, you're going to want to keep it to where they can still receive some of that oxygen there. You primarily see these in the acute care setting. We don't always see them in the long-term care environment. Next, we have our face plate. And here it shows us what size the trach is. This is a 6 and it's a fenestrated trach. Fenestrated means it has an opening on the inner portion that allows air to come through, and this will allow your client to be able to speak. Our normal sizes are 5 to 8. Here we have our outer cannula, and you can see maybe there's a little circle there that shows us if it's locked or unlocked. To be able to unlock the outer cannula, we're going to turn it counterclockwise. You just pull it directly out. And here we have our inner cannula. It's very important that during cleaning that we're going to be keeping the inner cannula sterile. To lock it, you just put it in and turn it clockwise. Here we have our 4x4. It's fenestrated, so it's already cut. It fits right underneath the faceplate. And then we have our Trache Ties. In some facilities, you will see not the traditional Trache Ties, but the Velcro, which is very, very nice. So these are the pieces that go into the faceplate here, and you can adjust your size for the client according to their neck size. So we have those, and those are disposable. They're very nice. Next, we have this little red stopper. And when a client is ready to be what we call decannulated, so they are getting close to not needing their trach anymore, you will see this red stopper on the front of their trach. This trach that I have here is a disposable trach. And so that means that the inner portion you can take out and dispose of and get a brand new one. So you do not have to clean this one every day. I'll also show you here that we have a cuff on this trach. This is primarily used in ventilated patients to help ensure that the air is going down the airway, and it also helps to prevent some aspiration. The last item that I have is called an obturator. Let's say that we have a client with a brand new trach site and the trach was removed or it came dislodged. We want to be sure and put this into the tracheostomy site, into the stoma, to make sure that it stays open until we can get a new ostomy appliance in. Okay, so let's go ahead and get started on our Trache Care portion. First thing you're going to do is you're going to gather your equipment. Unlike other skills, we do not need to check an order for this skill. Trache Care and cleaning is a nursing intervention. So we're going to get our equipment. What we're going to need is our towel, our Trache Care kit, sterile saline, and hydrogen peroxide. So I have gathered my equipment. I'm coming to the bedside and I'm going to perform hand hygiene. Okay, we'll get our gloves on after we performed hand hygiene. And of course, we're always going to provide patient privacy by either shutting our door or moving our curtain as well. We have to remember with our clients with a tracheostomy, they may or may not be able to speak depending on what type of trach they have. Again, a fenestrated trach allows for the client to speak. This client is not able to speak, so I'm going to make sure that I check patient identification on the ID band. Mr. Stanley Smith, date of birth, good deal. So Mr. Smith, what we're going to be doing today is we're going to do Trache Care. So we're going to remove your dirty dressing and make sure that you don't have any signs and symptoms of infection. Now that I've explained and I've identified my patient, let's make sure that we have the head of the bed up. The bed is to appropriate level. and our side rail is down. Let's go ahead and get our towel in place. You may be wondering why we're going to place the towel. After you've done trach care for a little while, you'll notice that some clients have quite a bit more secretions than others, and so you want to protect their gown. On that same note, if your client, of course, has MRSA or any type of precautions, make sure you put on your appropriate PPE. So now that we have our towel in place, if I had a trach collar, I can move that to the side, and then we're going to go ahead and take out our old dressing. And you can dispose of that. Make sure, though, that you are noting what the secretion looks like. Is it have any specific color? Is it a small, skin, or copious amount? We're also going to look at our stoma site to see if it has any redness. If this was a newer trach, we want to see if there is any irritation or any bleeding before we move on. So now that we've taken out our old dressing, it's time to go ahead and remove our gloves, perform hand hygiene, and prepare for our sterile portion. Okay, so I've removed my gloves, I've performed hand hygiene, now it's time to set up my sterile field. Of course, with our sterile packages, we're going to be sure to open away from us. We also want to remember that once we are sterile, we want to keep our hands above our waist. We do not want to cross over our sterile field, and you do not want to turn your back to the sterile field as well. The first thing that we're going to do is put on our sterile gloves. I do want to mention that these are probably a 7 or a 7.5. They're inside of these specific sterile packages. So if you have a smaller hand, you may want to go ahead and bring a smaller size of sterile gloves. If a larger hand, you may want to get a larger size as well. It will definitely benefit you to have the right size gloves on when we're changing the trache ties. So I'm going to go ahead and put my sterile gloves on. Okay, the next thing you're going to see in your package is your sterile drape. So you're going to want to pick up the drape. Open your sterile drape and place it next to you. The next thing you're going to want to do is to take out your supplies and put them on your sterile drape. And now remember, I can't touch this in the center. This is sterile. Pick up my sterile supplies. I would like to show you what is inside of this package here. We do have some new Trache Ties. We have our pipe cleaners. According to evidence-based practice, these are no longer recommended because of the filaments, and they could get into the airway. We have 2 cotton tip applicators that we're going to be using for cleaning around the trach site. We also have our sterile brush. I'm going to go ahead and put this inside my large container. You have multiple 4x4s for cleaning. We'll utilize those in a little bit. And then, of course, we have our fenestrated, which means that it is cut gauze. I know some may have seen nurses cut regular 4x4s to put around possibly a peg tube site, but we want to make sure that we do not cut a 4x4 and place it around the trach site, as you could have little threads that could get into the stoma area. So the next thing we're going to do is I'm going to contaminate my non-dominant hand. So I'm going to open up my saline, placing my lid right side up. Open up our hydrogen peroxide. We have 3 compartments, 2 small ones and 1 large, and we're going to be putting sterile saline into all 3 compartments. Next, we're going to use hydrogen peroxide. What I would like to say is that it is based upon your hospital facility if you will be using hydrogen peroxide or a soap and sterile water mixture. We want to add the same amount of hydrogen peroxide as you have sterile water for a 1-to-1 mixture. Another important thing is you do not want to use hydrogen peroxide solution if you have a fresh stoma, as it could damage the new tissue. Okay, so I'm going to turn over here, still using my contaminated non-dominant hand, and I'm going to take out the cannula. So we're going to grab a hold here, turn counterclockwise, and remove the trach. Still holding on to the outer portion, I'm going to set it into the hydrogen peroxide mixture and kind of move it around a little bit. Let it get some of the secretions out. Then I'm going to take my sterile hand and clean the inner portion of the trachs. We'll clean really good. Sometimes they can really get goopy in there. I have to get on the outside a little bit as well. Then we will dip it into the sterile saline here to rinse. Tap on the edge to get your excess water off. Then you're going to put it back into the trach. It's a little bit wiggly. Put it right in, still holding on to the outer portion, and turn clockwise to lock. Now that we have replaced our inner cannula, we no longer have to be sterile. The next thing that we're going to do is we're going to clean around our trach site with our cotton tip applicators. So you can take one of your applicators and we're going to go into the saline that we have not used, the little compartment there. And you want to get back behind the faceplate. I like to clean from noon to 6. So you kind of get around there. I can discard that one. We'll do the other side. Of course, we would clean very thoroughly. And then next, you can take one of your gauze. I like to fold it up, dip it into the same compartment there. And we're going to clean the faceplate off. We can clean around the neck as well. Now, and we'll dispose of that. The next thing that we're going to do is we're going to change out our trache ties. I will say this can be a little bit tricky with our gauze. So let's take our trache tie. The first thing I like to do is make it nice and straight and even. And then we're going to take one end of it. I would hold it pretty close there. We're going to go into the side here and pull through. I want to point out something very important. You may be wondering, why are you not taking off the old before you put on the new? Well, if we take off the old one before we put on a new one, the client can cough and would totally dislodge the trach and the faceplate. So we want to make sure that it is secure till we get our new straps in place. I make sure that I have them both the same length. I'm going to go back behind the head. Excuse me, Mr. Smith. I'm going to reach behind you here. Then we're going to take one end, and put it right here into the faceplate again. Then we're going to tie a knot right here on the side. We want to make sure it's snug. We also want to make sure we get away from the carotid artery. We don't want it resting against the carotid artery there. So up here toward the faceplate. And then once you have tied your trache tie, then you can go ahead and release the old one and remove it. a little bit tricky. Last but not least, we can dispose of this, of course. Last but not least, we're going to be inserting our fenestrated trach dressing. Again, we need to be careful. We will thread it right up through the back, behind the faceplate. Excuse me, sir. The important thing here is you want to check and make sure that the fenestrated gauze does not cover the ostomy site. Once we have done that, we have finished our task, and so we're going to dispose of our supplies, take off our gloves. Of course, make sure your patient is safe by lowering them back down to the appropriate level and putting up your side belt. And that concludes your trach care skill.